Dr. Craig Spencer wrote this in an op-ed in the New York Times. He says, quote, "I fear healthcare collapse more than Omicron." Dr. Craig Spencer is here with me now. Thank you for joining me, Dr. Spencer. You know, it's unbelievable. I'm glad you're here, but I tell you, it is unbelievable to see those maps and those figures and think about where we are right now in January 2022. And you can imagine there is fatigue among the people on this very issue. But you want to caution people, don't let the fatigue and wanting to be vaxxed and done lull you into a false sense of comfort, right?
Absolutely. Look, what I think is really important for people to understand right now is I know you're fatigued. There is good news in addition to that daunting news that you just shared. Look, this is not March 2020. We know that the likelihood of having severe illness, especially if you're vaccinated, is much lower. We have other treatment options. We have other things that we can do. Years of experience in treating this disease. So that 2,600 number of deaths is huge, but likely, just a year or 2 years ago would have been much higher. We've learned a lot. The problem is that right now we have hospitals where there's not enough nurses to take care of the patients who are coming in, the COVID patients and the non-COVID patients. That's exactly why we need to do everything we can to try to limit the number of people that are infected, not just those that are older or unvaccinated or maybe not boosted, but everyone, because each infection represents another potential to infect more people, and we need to do whatever we can to slow that spread right now to ease the pressure on our hospitals.
And so what are you seeing personally? I mean, you tweeted out as personal anecdote just today alone, and you said, last night I took care of COVID patients. One was dehydrated and had renal failure from COVID. Another had a stroke. Others need oxygen, including high flow unvaccinated. And one that had COVID but couldn't go home because her home health aide wouldn't come anymore. I mean, how troubling to hear what's happening on the ground.
Right. This is different than a year ago or 2 years ago. And that, I would walk into the hospital then and it felt like the apocalypse with so many people on the ventilator, so many people dying every day. Right now, we're still seeing sick people that need oxygen, the overwhelming majority of which are unvaccinated. But a lot of the patients that we're seeing right now have underlying chronic conditions that are being exacerbated, being made worse by COVID. So they may not look like that classic COVID patient, but as I pointed out, someone who gets COVID is dehydrated and needs to stay in the hospital, or someone who gets COVID and is too weak and they can't go home because they're a fall risk. Now, those aren't as bad in one sense as those kind of classic COVID patients we were seeing before, but every single patient that needs to stay in the hospital takes up a bed, and beds and staffing are what in short supply right now.
And when you said the idea of underlying health conditions, my mind went to the fact that although COVID-19 obviously has exacerbated so many things, it's not as if cancer went away or breast exams needed to not be performed any longer or colonoscopies didn't need to be done or routine health screenings. I mean, all these things also, in addition to the appendicitis and every other condition, arm breaks and the like, heart attacks, these are all still happening. And so for every bed taken, that means the attention and resources can't go to those people in a timely fashion.
Correct. Not only are we pulling away those resources from those patients, but we're putting them at greater risk. My greatest fear, and the thing that I've been trying to do the most in recent shifts, is to control exposure for those that are in the hospital without COVID to try to prevent them from getting it. Patients that have cancer on chemotherapy who come in because they're having side effects and have done everything they can, including getting vaccinated, multiple doses, but whose immune system doesn't respond in the same way, and for whom an infection would be a lot more severe. And so that's what I'm trying to do. Go around, make sure they have masks on, try to separate people. But with so many people coming in at the same time with COVID, for non-COVID reasons, whatever it is, it makes it a lot harder to do that job to keep the COVID patient safe and the non-COVID patient safe as well.
Dr. Craig Spencer, thank you for giving us the context about the entire health system as an ecosystem, not just one directive. I really appreciate it. Thank you.
Thank you, Laura.